it going?
I think, yes.
Okay. So what would you do if you heard your doctor say you had stage 5 kidney disease, or your lung disease was too advanced to be stabilized? They give you many options for treatment, but the one that strikes you hardest is organ transplant. When you hear organ transplant, you can only imagine the difficulty in finding a person who is not only willing to donate an organ, but also be a compatible match. Well, according to the U.S. Department of Health and Human Services, every 9 minutes, someone is added to the transplant waiting list and having to face this hardship. My grandmother, like most grandmothers, is a very influential part of my life, even at 26 years old. She's taught me how to cook, what Spanish music is worth listening to, and how to care for others. Despite being only 65 years old, she was recently diagnosed with renal failure and is going through dialysis. She's been given the option of an organ transplant and, like most cases, her family members are being looked at first, and I find myself being looked at as a possible donor. It's a difficult decision to make, but all I can do is think about my grandmother and research the facts of organ donation. As members of the medical community, we know that becoming an organ donor is not just a checkbox on driver's license forms. It's a selfless act that can improve and prolong the lives of our patients. Today, I will be discussing the issue of lack of organ donors and how the Health Resources and Services Administration is helping with this problem and what our community would look like with and without the support. Despite over 90% of people supporting organ donors and transplants, only 60% of people are registered to become organ donors, as reported by organdonor.gov. As of March 2020, over 112,000 patients are in need of life-saving organ transplants in the U.S. And according to Donate Life America, of those 112,000 patients, 83% need a kidney. If you or your loved one needed a transplant, this lengthy waiting list could hinder yours or their fighting chance to live and continue to make lasting memories. So now that we talked about the problem of lack of donors, let's move to the solution: how to register and the facts of donorship. So the solution to the problem of lack of donors lies in the relaying of proper information on both how to register and debunking the myths. Registering as a charitable donor is easy and simple to do. You can simply go to organdonor.gov, give simple information such as name and date of birth, and you are instantly added to the National Registry for Organ Donation. Now, some of you may be thinking about the myths associated with organ donorship. Some of these fictitious stories include hospital staff not working hard to save your life while in the hospital, being taxed with the cost of the donorship, or not being healthy enough to be a compatible donor. These are simply untrue statements. Doctors and nurses in hospitals work hard every day to sustain the lives of their patients. Their number one priority is to give patients the best care possible. When it comes to the cost of the transplant and the organ donation, these are not billed to the family of the person donating. These costs are billed to the recipient of the transplant. And finally, when we think about becoming a possible donor, a lot of hesitancy comes from the belief that our bodies are not healthy enough to be a suitable match for donation. However, according to the Mayo Clinic, very few medical conditions disqualify you as a possible donor. Upon death, a board-certified clinician will determine whether or not your organs are viable to be transplanted. So now that we've talked about the solution, let's move on to the vision of our community. Without an increase in organ donorship registration, patients who are in dire need are unable to keep on living. According to the National Kidney Foundation, in 2014, over 4,700 patients died while waiting on a kidney transplant. That's 12 patients a day who are unfortunate enough to not survive while waiting on what seems like a never-ending transplant list. With the increase of registrations, people will be able to continue to spend time with their loved ones. The waiting list of over 112,000 will eventually decrease and hopefully come to a more manageable number. So today, I discussed the problem of lack of organ donors, how the Health and Human Services is helping with this problem, and what our community would be like with and without the support. As stated previously, people can register to donate at organdonor.gov. You can even register as a living donor. Contact information for the Department of Health and Human Services is hhs.gov, where you can find additional information on how to register, transplant statistics, and more. In conclusion, registering to become an organ donor is a generous and essential part of our community. Whether it's my grandmother or a stranger, every donor counts, and just one donor can save 8 lives.